Welcome, students, to today's lecture on the topic of peripheral nervous system assessment. In this lecture, we will delve into the intricate details of examining the integrity and functionality of the peripheral nervous system, specifically focusing on sensory perception, motor strength, coordination, reflexes, neuropathy, nerve conduction studies, autonomic function, cranial nerve examination, dermatomy, and myotome examination, nerve compression syndromes, polyneuropathy differentiation, and pain assessment in peripheral neuropathies. By the end of this lecture, you should have a comprehensive understanding of the various assessments and diagnostic techniques used in evaluating peripheral nerve function. So without further ado, let us begin our exploration. To assess sensory perception, it is important to evaluate the patient's ability to perceive various sensations. This includes assessing the patient's ability to differentiate between sharp and dull, hot and cold, and light touch versus deep touch. By examining these sensory modalities, we can determine the functioning of the peripheral nervous system and identify any abnormalities or deficits. Motor strength evaluation involves assessing the strength of various muscle groups using manual resistance testing. This is done by applying resistance against the movement of the muscles and grading the strength using standardized scales such as the Medical Research Council (MRC) scale. By evaluating motor strength, we can identify muscle weakness or paralysis and determine the underlying causes. Coordination examination involves assessing the patient's ability to perform specific tasks that require fine and gross motor coordination. Common tests include the finger-to-nose test, where the patient is instructed to touch their nose with their index finger, and rapid alternating movements, where the patient rapidly moves their hands or feet back and forth. By evaluating coordination, we can identify any abnormalities in motor control and coordination. Reflex assessment is an essential component of peripheral nervous system evaluation. This involves testing deep tendon reflexes, such as the patellar reflex or the Achilles reflex, by tapping the associated tendon with a reflex hammer. In addition to assessing normal reflexes, we also look for pathological reflexes, which can indicate underlying neurological conditions. Neuropathy evaluation involves a comprehensive assessment of signs and symptoms to identify and diagnose peripheral neuropathy conditions. This includes evaluating symptoms such as numbness, tingling, pain, or weakness in the extremities. Additionally, various diagnostic tests, such as nerve conduction studies and electromyography, may be conducted to confirm the presence of neuropathy and determine its underlying cause. Nerve conduction studies, NCS, are diagnostic tests used to evaluate the health and functionality of peripheral nerves. NCS measures nerve conduction velocity, which reflects the speed at which electrical impulses travel along the nerves. Additionally, electromyography, EMG, may be used to assess the electrical activity of muscles and identify any abnormalities that may be related to peripheral nerve dysfunction. Autonomic function testing involves assessing the function of the autonomic nervous system, which controls involuntary bodily functions. This includes evaluating heart rate variability, which reflects the adaptability and responsiveness of the autonomic nervous system. Pseudomotor function assessment, which examines sweat gland activity, and pupillary reflex examination are also performed to evaluate autonomic function. Cranial nerve examination involves assessing the function of the cranial nerves, which play a crucial role in peripheral nervous system function. The examination focuses on evaluating abnormalities in specific cranial nerves, such as visual disturbances related to the optic nerves or facial weakness related to the facial nerve. By conducting a detailed cranial nerve examination, we can identify any deficits or abnormalities that may be indicative of peripheral nerve dysfunction. Dermatomy and myotome examination involves precisely identifying specific areas of skin and muscles that correspond to specific spinal nerves. By mapping out these areas and evaluating any abnormalities or deficits, we can localize the site of nerve damage and determine the underlying causes. Nerve compression syndromes, such as carpal tunnel syndrome and ulnar neuropathy, are common conditions that result from nerve entrapment. These conditions occur when a nerve is compressed or constricted, leading to symptoms such as pain, numbness, or weakness. It is crucial to recognize and diagnose these conditions accurately to provide appropriate treatment and prevent further nerve damage. Polyneuropathy refers to a condition characterized by damage or dysfunction of multiple peripheral nerves. It can have various etiologies, including metabolic, toxic, autoimmune, or hereditary factors. Differentiating between the different types of polyneuropathy is important in determining the appropriate treatment approach. This involves considering the patient's clinical presentation, pathological findings, and underlying causes. Pain assessment in peripheral neuropathies involves evaluating and differentiating between neuropathic pain, which arises from damaged or dysfunctional nerves, and nociceptive pain, which occurs due to tissue damage or inflammation. Specialized pain assessment tools and scales, such as the neuropathic pain scale or the visual analog scale, may be used to assess the intensity and quality of pain. This helps in tailoring an appropriate pain management plan for patients with peripheral neuropathies. In conclusion, assessing the peripheral nervous system involves evaluating sensory perception, motor strength, coordination, reflexes, neuropathy, nerve conduction, autonomic function, and cranial nerve function. This comprehensive examination helps healthcare professionals diagnose and treat peripheral nerve conditions effectively.